it is possible for them to recover. Actually, up to 80% can recover from childhood cancer, but it requires resources. If you come here and see these children, and you know it just takes resources to help them.
Located on Block A of the New Mulago Hospital Complex, the Children's Cancer Unit is dedicated to the treatment of children with cancer. Most of these children stay here for a long time as the healing process takes time. And Akulo, a child cancer specialist at Mulago Hospital, says with Global Hope program, a number of children have been diagnosed with cancer and treated.
Better survival is achievable through your hands. So generally, partnering with him, partnering with the Lions, with all the other partners, we all, when we put our hands together, we can improve the survival of children with cancer.
She says a number of cancer pediatric specialists are being trained to handle child cancer patients. The head of the unit, Dr. Peter Waiswa, says there is a lot of hope as the recovery rate among children with cancer improves by 10%.
When we see a child with cancer, their chance of surviving, certainly now in our unit, is 70%. So that means 70% of children are likely to survive at least 1 year from diagnosis of cancer. That means 30% will be deceased. That said, as I said, that's the tip of the iceberg. It's estimated that 90% of children with cancer in Africa, Southern Africa, will die from cancer.
Waiswa says childhood cancer is curable when children access diagnostic, therapeutic and supportive care. The Lions Club International is now facilitating Mulago to ensure a state-of-the-art treatment intervention that include medicine access, equipment and specialized personnel.
We've trained over 800 healthcare workers across the spectrum healthcare. Of these, we've trained about 20 specialists in pediatric hematology and oncology over the last 5 years and training more. We've reached over 1,000 patients actually with cancer and over 5,000 with blood diseases.
This was disclosed during a visit to Mulago Hospital by the first Deputy President, Lions Clubs International, Dr. Patty Hill, and her spouse, Greg Holmes, the Governor, District 411B, John Bosco Ntangare, and senior Lions Clubs members.
Ongoing partnership of the Mulago Hospital staff, Global Hope, Blessed Child, and the Lions Clubs International Foundation is ensuring that children with pediatric cancer will have hope.
So we shall certainly be around to support you and to ensure that this support from Lions Clubs International Foundation, which is coming, is implemented. And we have a reputation for good accountability as well as in Uganda.
But lack of awareness of childhood cancer, the absence of a well-equipped and trained health workforce, scarcity of anti-cancer medicines, misconceptions and biases about childhood cancer, and a lack of financial and social support to maintain people on care remains a challenge.
The childhood cancer project at Mulago, where we are investing close to $2 million in 3 countries to establish facilities to help young children who are suffering from cancer. But our biggest challenge, of course, like any other resource mobilization drive, is that it takes people really to be touched to know why they should